Chapter 9. The Dichotomy of Memory. Autobiographical versus traumatic. Introduction. Memory plays an essential role in shaping our identities and experiences. In psychology, a significant distinction exists between autobiographical memory, which allows us to recall past events, and traumatic memory, which often resurfaces in vivid and distressing ways. Understanding this distinction is essential for clinicians working with trauma survivors, as it directly influences therapeutic approaches and recovery processes. This chapter explores the differences between these memory types, supported by fundamental research, and discusses their implications for the cell danger response, CDR, and salutogenesis. Understanding autobiographical memory. Autobiographical memory refers to the ability to recall in your mind specific events from your life. It is often characterized by a coherent narrative and contextual details. This type of memory is typically stored in a way that integrates emotions, sensory information, and personal significance. The hippocampus plays a critical role in this process, helping to contextualize memories and provide a structured narrative that allows individuals to reflect on their past. Traumatic memory characteristics. In contrast, traumatic memory is often characterized by fragmentation and heightened sensory recall. When a traumatic event occurs, the memory is encoded differently, frequently lacking the coherence and narrative structure seen in autobiographical memories. Traumatic memories may be recalled as disjointed images, emotions, or sensations, leading to what individuals often describe as reliving the experience. Key research findings. Bruin et al., 2010. This study explores the neuroimaging differences between traumatic and autobiographical memories. It found that heightened sensory details and emotional intensity characterize traumatic memories, whereas autobiographical memories are more coherent and integrated. The research suggests that traumatic memories lack narrative coherence and are primarily processed in the amygdala and sensory cortices rather than the hippocampus. Dual representation theory. Bruin, 2001. Bruin's theory proposes that traumatic memories are stored in two distinct ways: verbally accessible memories, VAMs, which resemble autobiographical memories, and situationally accessible memories, SAMs, which are more sensory and emotional. SAMs are often challenging to integrate into a coherent narrative, leading to flashbacks where the memory feels immediate and present. Van der Kolk's research, 1994-1995. Renowned trauma expert Dr. Bessel van der Kolk emphasizes that traumatic memories are often encoded in fragmented forms, relying more on sensory and emotional recall. Individuals may struggle to verbalize these memories, resulting in experiences that feel disjointed and unmanageable. Neurobiology insights. Nadell and Jacobs, 1998. This study highlights how stress hormones, particularly cortisol, affect the encoding of traumatic memories. Traumatic experiences lead to overconsolidation in the amygdala and underconsolidation in the hippocampus, explaining the vividness of traumatic memories despite their lack of coherent context. Van der Hart et al., 2006. In The Haunted Self, the authors discuss how traumatic memories are stored in sensory and somatic forms, often lacking the temporal coherence of autobiographical memories. This lack of integration leads to experiences of flashbacks or vivid re-experiencing, making it feel as if the trauma is occurring again in the present. Neuroimaging studies. Lieberzahn and Martis, 2006. Neuroimaging studies reveal that recalling traumatic memories activates the amygdala while decreasing prefrontal cortex activity, which is responsible for cognitive control and narrative processing. This pattern helps explain the raw emotional experiences tied to traumatic memories. Dr. Ruth Lanius's perspective on traumatic memory. In a recent Perspective article, Dr. Lanius discusses how traumatic memory is marked by sensory-motor fragmentation, where traumatic memories consist of unintegrated sensations and actions. The article argues that current PTSD treatments often overlook these sensorimotor processes, leading to high dropout rates among patients. This highlights the urgent need for interventions that integrate fragmented memories into a coherent narrative. Implications for trauma recovery. Understanding these distinctions between autobiographical and traumatic memory has profound implications for treatment. The fragmented nature of traumatic memories can contribute to the activation of the cell danger response, CDR, a physiological state triggered by stressors, including trauma. When traumatic memories are not fully processed, they can perpetuate the CDR, keeping the individual in a state of fight or flight. Therapies that focus on integrating traumatic memories, such as somatic experiencing, EMDR, and sensorimotor therapy, can help individuals move from a CDR state to one of healing and recovery. This shift is essential for promoting cellulogenesis, allowing the body to transition from chronic stress to cellular repair and well-being. Conclusion. The differences between autobiographical and traumatic memory underscore the need for targeted therapeutic approaches in trauma recovery. Recognizing how traumatic memory drives the CDR and hinders healing highlights the importance of addressing these memories in clinical settings. Key takeaways. Dichotomy of memory. Autobiographical memories are coherent and contextualized, while traumatic memories are often fragmented and sensory-rich, leading to distressing re-experiencing. Neurobiological distinctions. Traumatic memories are processed differently in the brain, primarily involving the amygdala and sensory cortices, as opposed to the hippocampus, which is crucial for narrative memory. Dual representation theory. Traumatic memories can exist as verbally accessible memories, VAMs, and situationally accessible memories, SAMs, with SAMs being harder to integrate and often causing flashbacks. Sensorimotor fragmentation. Traumatic memories may be characterized by unintegrated sensations and actions, making it difficult for individuals to contextualize and verbalize their experiences. Implications for treatment. Current PTSD treatments may not adequately address sensorimotor processes, emphasizing the need for interventions that help integrate traumatic memories into a coherent narrative. Connection to CDR and cellulogenesis. Understanding the relationship between traumatic memory and the cell danger response, CDR, can inform therapeutic approaches, promoting recovery and health through cellulogenesis. References. Bruin, C.R., Dalgleish, T., and Joseph, S., 1996. A Dual Representation Theory of Post-Traumatic Stress Disorder. Psychological Review, 103 4 670-686. https doy.org 10.037/0033-295x.103.4.670. Bruin, C.R., Gregory, J.D., Lipton, M. and Burgess, N. 2010. Intrusive Images in Psychological Disorders. Characteristics, Neural Mechanisms, and Treatment Implications. Psychological Review, 117, 1, 210-232. https doy.org 10.037/00181113. Kearney, B.E., Lanius, R.A. Why Reliving is Not Remembering and the Unique Neurobiological Representation of Traumatic Memory. National Mental Health 2, 1142-1151, 2024. https jockdoy.org 10.038/S44220-204-00324Z. Liberzon, I. and Martys, B. 2006. Neuroimaging Studies of Emotional Responses in PTSD. Annals of the New York Academy of Sciences, 1071, 187-109. https yadoy.org 10 Lund 96 Annals, 1364, 009. Nadel, L., and Jacobs, W.J., 1998. Traumatic Memory is Special. Current Directions in Psychological Science, 75, 154-157. https bidoy.org 10 467 721 IPNO 8 Van der Hart, O., Nijenhuis, E.R.S. and Steele, K. 2006. The Haunted Self, Structural Dissociation in the Treatment of Chronic Traumatization. Norton van der Kolk, B.A. 994. The Body Keeps the Score. Memory and the Evolving Psychobiology of Post-Traumatic Stress. Harvard Review of Psychiatry, 15, 253 to 265. https doy.org 10.309/10673229090170888. Van der Kolk, B.A. and Fisler, R. 1995. Dissociation and the Fragmentary Nature of Traumatic Memories. Overview and Exploratory Study. Journal of Traumatic Stress, 84505-525. https jadoi.org 10.002 jts.24900804042.